Hello, this is Dr. Camille Kraus. I am a naturopathic doctor with Conceive Health, working out of Kitchener-Waterloo and broadcasting from my living room. So today we'll be talking about cervical mucus. So embrace that term. I'm going to be saying it a lot in this video. The short answer is we want cervical mucus and we want to start noticing it. It acts as the sperm superhighway to get it where we want it to go, ready to meet that egg. So step one is noticing it, and step two is troubleshooting if we're not finding that we have any. I have to jump in and tell you, can you get pregnant if you don't have that really good egg white cervical mucus? Yes, you still can. It just means you're going to have to be timing intercourse right in and around ovulation because the sperm won't have that really good support to stay nourished until you ovulate. So through the cycle, you're going to notice that your discharge changes. It's going to change from a kind of a slippery, watery, maybe white kind of a discharge. And then leading up to ovulation, usually like a couple days before, if not the day of, you're going to notice a jelly-like, stretchy cervical mucus, kind of like raw egg white. That's where the name comes from, egg white cervical mucus. And you're going to notice it when you wipe, or you might notice it in your underwear. So what happens if you are not noticing that discharge? One thing that it could mean is low estrogen. Estrogen is a very Goldilocks hormone. Normally, I'm looking at patients' day 3 blood work where estrogen is tested, and I want it to be, above 80 and below 200, maybe 250. Fertility clinics say around 300, 350. We want it in a certain range to be that healthy, happy estrogen. And if it's too low, then we're not driving that whole process to even make the cervical mucus properly. So that's one thing. We want the hormone balance overall to be in line with our fertility goals. Next thing is we want good flora in the vaginal canal. So anyone who has yeast infections or has had yeast infections or has had some rounds of antibiotics, even if it's for, UTI, strep throat, unrelated things, it's still going to impact the flora in the vaginal canal, and that will impact the lubrication that we are making. So our lactobacillus species is actually our main species in the vaginal canal that works with our body to make our lubrication and our discharge. And so that's another thing that I'm watching for and asking questions about, and that you can watch for or think about if you're not noticing the changes in discharge that I talked about. Next thing would be to stay hydrated. So, we can't make these bodily fluids if we're not intaking proper fluids. So at bare minimum, bump up your fluid intake the week before ovulation. But of course, I'm going to tell you to bump up your hydration all month long. I want to see patients drinking 2 liters. I know you might hear more, hear less. Aim for 2. It's a good, happy number. Next, we want good fatty acids. So that's our omega-3s. And I can tell very quickly as soon as I bring up omega-3s how patients feel about fish. So if you don't like fish and you're just not eating any fish, you need to be on an omega-3 supplement. We use it all the time for not only for, egg quality and our endometrial lining, that good thick lining for implantation. But I also want it for kind of being able to make healthy hormones and good cervical mucus as well. And then the last thing I want to talk about is movement and exercise. And basically what we mean by that is blood flow, right? We want to drive blood flow to our reproductive organs so that they can function the way that they want to and need to, and drive all of those nutrients we're putting in to that site of action. Thanks for watching, and I'll see you in my next video.